Hey, this is Phyllis. I wanted to do another update on my cubital tunnel surgery that I had June 5th, 2008. Today is December the 5th, 2008. And I've already done one video on recovery. I try to do videos on recovery because there's not any out there that I know of. Most people go to the forums before they have surgery. They're looking for information on what type of tests they'll have, the symptoms of cubital tunnel syndrome, and you know, what to expect after the surgery. And then after people have surgery, they don't come back and, you know, tell each one, you know, how they're progressing month for month. And usually the only information we have, like for myself, my doctor just said, well, it'll take a year to 18 months for all the numbness to come out of my hand. So I just decided, since I have a YouTube site anyway, that I would go ahead and just post these updates. And like I said, I did an update about a month ago on my progress. And I wanted to do this update because I've been having some problems that I wanted to share in case anybody else was having these problems. I hope that this video will be helpful. The first thing that I've been noticing in a lot of the forums is people are asking about how long they'll be out of work or when they can go back to their normal duties. Well, for me, I had the surgery right here on my elbow. The doctor just went in and made like a 1-inch incision and cut that tendon that was swelled up, that was keeping that ulnar nerve compressed. And for me, I was back out in my yard the very next day doing yard work. I wasn't doing anything strenuous or anything, you know, like that. I was just, you know, out doing just the, you know, minimal stuff, mostly just getting outside. And, you know, I could carry stuff. I didn't really carry anything, probably over 3 pounds, but I was, you know, back outside and you know, moving around and went shopping. Actually, the day of the surgery, I had the surgery like maybe 1 o'clock in the afternoon, and at 4 o'clock, you know, after I got home, or 5 o'clock, I went out to supper and was out shopping at Walmart and things like that. Because you know, like I said, that particular surgery that I had, it was no big deal. It was the main thing was just waking up and your palm and pinky finger, ring finger, you know, still numb. Because it's going to take, you know, a year to 18 months for it to heal, because the ulnar nerve heals 1 millimeter a day, which averages out to about 1 inch per month. And one of the, like I said, I did another update about a month ago, and one of the things that I'm really thankful for this week, I noticed one of the tests that the doctor will do is he'll have you to hold your hand open like this, and then it will be, because of the muscle waste, it'll be real easy to push in this finger and then real easy to push in this finger. Well, in my last video, as I said, I was getting back a whole lot of strength, and in the last couple of days it's just, you know, a blessing. But this finger's gotten a lot stronger, and especially this pinky finger, because it was just, you know, just wobbly. And now I've actually can push on it and have some resistance there, so I'm getting back a lot of strength. And like I said, I've been running into some problems that I wanted to share with you in case anybody else was having these problems. But for some reason, since I've had surgery, I've gotten in the habit in my sleep, which I have absolutely no control over, sleeping with these hands just locked in behind my head or across like this, or ever how I'm doing. And I'm waking up and showing the signs of the cubital tunnel in this hand, as well as I'm you know, clenching that arm back to the point that it's causing this nerve problems, because I'm waking up and my pinky finger, ring finger, and palm, it's just where it's so asleep. It just feels like this part of my hand is just numb, or really swollen, worse than what it normally is. And I talked to my doctor about that, and of course he recommended you know, a bunch of stuff. It just didn't work for me. One thing was an elbow splint, and everybody that's experienced an elbow splint or been put in one, the elbow splint keeps your elbow in about an angle like this. And if you try to sleep like that, the elbow splint is real bulky. Usually people rip it off in their sleep anyway. And it's really uncomfortable, because you can't move forward, you can't move back, you know, you can't do this, you can't do that. So after trying a number of things that were just unsuccessful for me, a friend of mine recommended just to get just a regular athletic sock. And what I did, was I stretched this, because this part of the elastic's pretty tight, and you don't want this to be on your arm or elbow in a manner like a tourniquet would be. So I stretched it out, really good, and I just cut the bottom out of it. Like I said, I've got this thing stretched really, really, really good. It is just completely loose on my arm. It could actually, fall off my arm. And then I slide the bottom part up here on my elbow like this. And then I sort of fold it over one time, and I bring it up like this, which is, really comfortable. It's just sort of like sleeping in a long sleeve shirt. And then I just take a pair of footies. You can pick these up at the dollar store, 2 for $1, and I just stick it right in here at the bend of my elbow and kind of work it down and fold it over. Make sure all this is up above my elbow, and it's, like I said, extremely, loose, up on both sides. Because, like I said, you want to make sure, that this is not like, not like you're putting on a tourniquet. You want it extremely loose. And right here in the bend of the elbow, I've got that footy. And I can still, bend this elbow, any which way I want to, and I still sleep like this, because I wake up and my arms are still back like this. But this sock is keeping me from clenching it so tight that I'm cutting the circulation off to that ulnar nerve, causing the numbness. And I use this on both elbows. And another problem that I'm having, sleeping with that wristband. And anybody that's had to use a carpal tunnel band here, or splint, this right here, I did take the little metal piece out of this, because that was just way uncomfortable. But not being able to bend anything but basically your fingers, and you sleep like this 6 to 8 hours. I mean, that's if you've got a normal hand that doesn't have carpal tunnel, it's going to cause you pain. So, sleeping like that was causing me a lot of pain. So I did the same thing. I just, used a sock, and I've got it pulled down like this. Have it I roll it around to kind of make it just tight enough to where it won't slip. And that footy, like I said, is like that. And it keeps that hand from just, just clenching it to the point that it causes my index finger, ring finger, and thumb from being numb. So yeah, I've got all this stuff on when I sleep, but like I said, it's not bulky. It's not any hindrance to me. It feels really good. I don't even know that it's on there because it's so comfortable. So these are just a couple of things that I wanted to mention. I know a lot of people, they say, well, they wake up and they sleep like this, but they don't have the same problems we do with the damaged nerve. And if you do have damaged nerve, either in one elbow or the other, you don't want to continue to sleep with your elbows clenched or your wrists twisted like this. And so I hope that this has been helpful to you. Like I said, a lot of people come to the forums or are looking for videos or other information, and they find really good information, but people just tend to not do recovery videos. And I think recovery videos are very good because it helps you emotionally too, knowing that, well, in 3 months, I'm going to be able to clap my hands together again, or be able to, scratch my head or my face. I'm not going to, feel this pain or all this weirdness. So like I said, I hope this video has been really helpful to you. And I hope you have a Merry Christmas, and God bless your recovery.